welcome to our Age of Globalization vlog. The purpose of this vlog is to bring awareness to maternal health issues.
Hi, my name's Leo. I'm on my way to the Maternal Mortality Review Committee meeting where I'm going to learn more about maternal health issues here in DC as well as globally.
Okay. We're outside the Consolidated Forensic Laboratory.
About to go into the MMRC meeting
Yes.
and see what we can learn.
Yep. We left the open section of the meeting and it's now closed to the public.
We're reviewing specific cases right now about maternal mortality deaths that have occurred here in DC. So we're not allowed to know about the specific cases for confidentiality purposes.
The people who are on this committee, they're doctors, they're professionals, human services, OBGYNs, other practitioners, also just looking to review infant mortality cases and find solutions.
During the MMRC meeting, Leo and I spoke in front of the committee, and our goal was to find an interview candidate that we would be able to ask some questions about maternal health, so we could inform the public and just become more aware ourselves about the issue.
So we just got off the train, headed to the HSC Healthcare Systems
to meet
interview with Donna Anthony.
She's the executive vice president of the hospital. And we're going to interview her, going to talk to her about maternal health and see what she can tell us.
Yep.
I'm Donna Anthony. I'm the Executive Vice President of Clinical Strategy at the HSC Healthcare System. We run a pediatric hospital in the District of Columbia. We see the impact of not having moms available, the importance of them being there for the support of the next generation and making sure that they can thrive. Most of the issues are around equity and access and equity and quality, and most people have insurance. I think the question is whether or not they're actually getting access to the quality care that they need to have a good outcome for themselves and for their babies. We call them social determinants of health, and that's when we think about food insecurity, housing, safe communities, transportation systems, and all of those things have an incredibly significant factor in the outcomes of maternal health, not just during pregnancy, but post-pregnancy as well. Time. People don't have time to make all of the appointments, especially if they have other children to care for. The other thing is transportation is a really big barrier, especially in certain areas of the city. So in wards 7 and 8, it can be really challenging. It can be 3 buses an hour long just to get to an appointment. If you're high risk, you might have to go weekly. Getting access to nutritious foods. If I'm not getting access, do I need to get linked up to Medicaid or a food program in the city? And there's lots of research around kind of disparities in access to contraception and also stigma around contraception. That stuff is definitely playing into maternal health issues, maternal mortality issues. It varies by race and socioeconomic status, and so African American women in the district are particularly vulnerable, and that's something that we need to be thinking about and building systems to make sure that they get the care that they need. We couldn't do anything about it. That something happened in labor and delivery when a mom was giving birth to a baby, or there was some complication, but about 98% of maternal deaths are preventable. A lot of the challenges around maternal health aren't always happening when a woman's pregnant. It's before they're pregnant or after they're pregnant. One conception is that these deaths happen and it's about the actual birthing process, and very rarely it is. There's not enough behavioral health services for moms, and that's definitely a risk and something that we need to do better at. We have so many providers and so many hospitals in this city, but are they located in the right places? So we call that place-based care, and that is locating care in the communities where people need it the most so that they're not having to deal with traveling across the city to get to an appointment all the time. About these constellations of care and thinking about how we can incorporate other professionals. You know, we put a lot of pressure on providers, on physicians to try to take care of that. And what we need to do is systematically change how we're paying for other providers to help.
So we just left the interview.
She taught us a lot.
She did, yeah. We learned a lot that we didn't know before.
Thank you to the MMRC and Donna Anthony for supporting us through this video process.
So now that you've learned about the maternal health issues in DC, There are a couple ways that you can get involved. The first of which is Thrive by 5 DC, which is run by Mayor Muriel Bowser. And the second is Mary's Center for Maternal